Why is it important to know the NAEYC health standards? It's important to understand the NAEYC health standards because they thoroughly explain different scenarios and situations that you must follow in order for children to maintain and grow in a healthy environment. It's important for us teachers and adults to be as healthy as we can for the children that we care for, and it's crucial to manage children's nutritional well-being and support them in healthy and beneficial ways, especially in early ages. As teachers, it's necessary to make sure before the child starts in the classroom, to be aware of any allergies or medical conditions that they may have. Before they start, you need to make sure that they have the medications with them at the center, and if they have any food allergies, to make sure that they have substitutions for whatever's on the menu that day. Teachers need to be aware of the USDA guidelines and follow them during meal times provided. Clean water must be available to the children, and liquids and foods that are hotter than 110 Fahrenheit need to be kept out of reach of children. The knowledge of NAEYC will help support myself creating a healthy environment because I have read and known about these standards for the last 8 years and since 2011 when I started working at the Military Child Development Centers. All Military Child Development Centers are accredited by NAEYC, so being very well aware and well-rounded about these standards is important for all the teachers in the facility. As teachers, we're trained to screen children upon entering the classroom, making sure that if they have any unusual health conditions or bumps or rashes, that they're cleared by a health professional before coming back. 2 actions that I would promote are appropriate hand washing. We must wash our hands for at least 20 seconds and follow the appropriate guidelines. Before we handle food, after we handle food, diaper changes, after we dispose of trash, and before and after administering medications. Another thing I would do would be to always place infants on their backs unless they have a physician's note. This is required to accredit the facility and reduce the risk of sudden infant death syndrome. Never put anything loose in the child's crib and never swaddle infants. I've been following the NAEYC standards, like I said, since 2011 for the protection and the well-being of the children, and it's important that every teacher is aware of these guidelines and procedures and keep themselves educated about the standards at all times.